If you enjoy this content, please take a moment to rate and review it. Your feedback will greatly impact our ability to reach more people. Thank you.
All right. It is Thursday, July 23rd. We are recording the 200th episode of the Health Further podcast. How are you doing, Vic?
I'm good. I'm excited to hit the 200 mark. I honestly didn't even consider how long we'd go, but 200 feels like a long ass time.
Yeah, man. We've been doing
200 weeks, or roughly 200 weeks.
Yeah.
4 years.
Yeah, there were a couple of weeks in there where we were doing two in a week.
We did some guest shows and things.
Yeah. We have some stories to cover, but I think also we're going to maybe just try to reflect a little bit about where we started this whole thing and where it is today and where we think things are in healthcare today a little bit. We were talking before we hit record about
maybe
that.
Take like 2 steps back, maybe not so much this week, but what's happening over a month or a quarter or a couple of years.
Yeah. I think also we want to thank those of you who have continued to listen and stick with us while we ramble every week about what's going on here. It certainly has been a practice of trying to decipher, distill, and digest everything that is going on in this crazy world we all find ourselves in. An incredibly crazy timeline, for sure.
Yeah.
For sure. I'll go ahead and say the line. Let's dig in. I was in Asheville last Friday. I think we recorded after that, right?
Yeah, we did.
And that was a good group for sure. There were some strong healthcare execs that were pretty innovative in the room. I have been reflecting now, having spent quite a bit of time at conferences over the last 2-3 months. I mean, June and July in particular.
Yeah.
I've done a bunch of conferences that have been pretty hospital-centric.
Yeah, kind of state groups or...
Yeah. A lot of state groups plus HFMA annual.
Yeah, right.
So I've been, I mean, maybe it's like 5 conferences in the last 2 months. You know, Vic, there is a pretty sober tone in these meetings. Before I hit the stage, people are talking about the reality of it's going to get worse before it gets better. There's plenty of bad news to go around. I mean, these are kind of these are the sentiments. I mean, they're showing up. They're in community. They're talking about how they're going to navigate this. What are you doing? What could we do? Is there a way to work together? All these things, right? Yeah. There is this sense of separation that I feel as someone who crosswalks these worlds.
Right.
Where I come in and I'm there to talk about things that I now know for sure at this point they don't see on a day-to-day basis. It's not in their family life. It's not in their social world, and it's definitely not in their work world. And it's so crazy to think about how those things are not fringe or niche. They're mainstream, and yet they could be out of the line of sight of the people taking care of the communities around this country.
Yeah. I mean, where you get your news, I mean, from big platforms like CNN or Fox or Wall Street Journal or New York Times or podcasts, or I don't listen to podcasts. It's a very different experience. And one of the things I love about doing this show, the reason I do this show is we cover all of those sources and try to bring it into one hour summary, which is hard, but it forces us then to look at these different feeds. And I think a lot of people that are my age, 55 or older, have an assumption that the news is broadly fair and balanced. Because when we were growing up, it was. And then sometime in the 90s, that rule of sort of giving equal time to both sides of an issue got thrown out the window. I can't remember the the ruling, but the FCC used to require that if you used their license, you had to present both sides of an issue.
Right.
And then that ended, I don't know when, 95-ish.
Yeah. I don't know if it was Citizens United, but like Citizens United was one of
that made it worse.
Yeah.
That made it worse.
Yeah.
It might have been inside of that. And so there's this assumption that I get my news every day. I'm following this, and I understand that there's some slanted things in the Wall Street Journal is more conservative than the New York Times, but in general, there's a belief that it is covering all the news of the day. And I don't share that belief. And from putting together this show, I think it's clear that it's very different worlds.
Very different worlds. It's very different worlds. And then I'll take it a step further, right? So even where there is shared awareness of something, it's then in completely different town squares of discussion. So for example, I recently saw the video of Mayor Mamdani talking about Benjamin Netanyahu being a war criminal, right? And I was like, you know what? I want to look at this video on X, and then I want to look at this video on Blue Sky.
Interesting. Yeah.
Same video.
Yeah. Right.
Right. But the thread below it.
Yeah. Right. Is very different.
The thread below it. Oh man. Like same video coming from the official account of Zohran Mamdani, and it's like two different, it's almost like he said it in two different parties, you know? And it's not just algorithms anymore. Like we can all choose our channel. And when everyone can choose their channel, it's like they're going to do the confirmation bias thing.
Yeah.
You're going to go where it reflects back to you what you believe. You know, and so even in spaces where the same information is shared, you don't get divergent discussion around it. You just get this echo chamber of response that just, reinforces whatever it is you like.
Yeah. Right. And we started with health systems, or maybe the finance arm of health systems with HFMA. That town square has a certain set of beliefs that I think are being challenged now from the very top, from the president of the United States to the administrator of HHS and down into the organizations. That's going to change the reality these health systems have to face. But I don't know that they're getting enough talks like you have. I mean, you bring them a great set of things to think about, but then they go back to their offices and their culture. There needs to be a lot of change. I mean, we have an operation that is much smaller and much more aware of these things, and we're making changes like this month because of all the changes coming in the world. And I just don't see that urgency to make changes that are required.
Yeah. And it's worrisome. Like let's not go in order. Let's skip around a little bit. We've got our show picked out here, right? But this story about Martin Luther King Jr. Community Hospital in Los Angeles. So my buddy Stan Frencher, he's a surgeon, urologist, and he's also a professor. And I know he does incredible work across the Los Angeles community, not just at this hospital, but he's got a legacy of working at this hospital. And like seeing this story, it's like fundamentally scary to me, The headline, "The financial threat is real. Los Angeles hospital braces for HR1 Medicaid cuts." Well, this is from Becker's Hospital Review. Los Angeles-based Martin Luther King Jr. Community Hospital is preparing to see $80 million to $100 million in Medicaid cuts annually tied to HR1, highlighting an urgency to keep the hospital operational for patients in the community. It's like, this is a safety net hospital. It's one of the most iconic ones in the country, but it's a safety net hospital. It's got a very colorful story. It's been through closures, it's been reopened. It's been this source of revitalization for the community. But like, no matter what you do on the ground locally, no matter how much support you rally around this institution, dude, safety net hospital cannot take $100 million cut out of nowhere one year. It just
They can't. They're not going to sustain.
it cannot.
They can't do
It
that.
cannot do it. It cannot. Let me just say, it can't do it and be what it is today, like remotely. It can't. It can't. It can't absorb that kind of impact, you know? And this is just one example. It's like, this is one story of hundreds, thousands, maybe. I mean,
every safety net hospital is going to face this. It's
every
worse.
hospital.
It's the worst in California. And we have a story somewhere that this week the Trump administration is questioning several reimbursements. Yeah, here, $1 billion in addition that they're withholding because the documentation in CMS's view is not appropriate. This is what I've been talking about. Like, it is, I don't know that they're saying it's fraudulent. They're saying it's fraud, waste, and abuse, and they want more documentation. There's a decent chance that the documentation is not going to be able to be come up with because they didn't collect the data. That doesn't mean that the services are fraudulent. What it means is they're going to have a hard time getting the money from the federal government.
Right.
And that's going to make it worse in California is, I think, like $950 billion. And then Minnesota is another $100 billion. And of course, it's not fair that they are putting a spotlight on blue states because they're trying to put a spotlight on blue states. But it's not going to matter to Martin Luther King Hospital. I mean, they're going to lose more reimbursement, and it's going to be, they're going to shut down service lines. I mean, they're going to have to shut down like significant parts of the offering to the community. And those people are still going to need healthcare services. Where are they going to go? They're going to go to some other hospital further away, not have as much access to care, and they'll be uncompensated there.
You know, one of the things where Jody Mitchell line, you know, doesn't always seem to go that you don't know what you got till it's gone, right? Mm-hmm. And I have this really big pit in my stomach that America as a society takes its healthcare ecosystem for granted. It's just there. It's been there so long, like, you know, you can just sort of abuse it, not treat it well. You know, we've had a really unfortunate rash really since COVID of demonizing it, you know. And it's like, is anyone looking at the jobs numbers? Like, forget caring for Uncle Joe, you know, when he needs it. Like the economy would basically collapse if healthcare was not actively hiring people today.
Yeah, it's been 75% of the jobs for the past 6 months.
Isn't it more than that?
Maybe it's more than that.
I mean, I feel like it's 85%.
Yeah,
I feel like the number has been really, really crazy concentrated with healthcare.
Yes.
You know? So 2027 is pretty scary.
Yeah. And then actually today, OpenAI came out with what the tech community solution will be, which is just use ChatGPT to do all your healthcare. I don't think that is possible. Many people listening will say that's not realistic because a computer in a cloud somewhere is not going to treat sick Uncle Joe if he has kidney failure. Like, you can get advice on things. You might get good advice. You might not get good advice, but the actual hands-on treatment of patients, maybe there will be robotics sometime in the future, but right now in 2026 and 2027, that's not possible. And so the tech community, and I have a lot of friends in the tech community, this is not an answer. This is an adjunct. This is useful, but I have fear that people are going to point to technology and say, like, that will take care of it, and it won't. It's not going to patch up a broken leg. It's not going to treat someone that has measles. Another story this week that's scary. Like, there's a lot of worrisome trend lines.
Yeah. And you and I are users of artificial intelligence. You know, my son was hanging out with us this morning at work. It was fun to have him around. And I think after our meeting where we were kind of batting back and forth things we're going to do with Claude, blah, 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 at the end, he was like, you guys use a lot of AI, and I know his generation is like not that thrilled about that, but then he was in the next call we were in where I was explaining our 25-50-25 model where, basically AI is in the middle, but we're on the front end doing the architecting, we're on the back. I think the important part is we're on the back end doing editing,
making sure,
and auditing, because we use it enough to know, like, it's an incredible accelerant. Okay. But the idea that it's a flat out replacement is just not real. Like, we don't have the most productive healthcare system we possibly could. So the idea that you would not integrate artificial intelligence into it feels like malpractice to me, right?
Yeah.
But we're still very much human in the loop, super human in the loop still. And by the way, that requires like a lot of upskilling and training the next generation of, clinical workers who are adept at collaborating with artificial intelligence. So yeah, no, I agree. Like, sending this stuff out there when we have people having relationships with ChatGPT, when we have people, thinking it's sentient and not understanding it's a prediction machine, right. It's like not. It's fine. Don't get me wrong. Like I'm all for people who can keep it in the right context, but we know that there are millions of people who cannot keep this in the right context.
Yeah, I mean, I guess Medicaid is the safety net for the country. Cutting Medicaid and cutting it in the way that they're doing is going to have a lot of negative jobs and negative human health outcomes. And it doesn't matter if you use AI very well or you use it poorly. It doesn't replace a nurse and a doctor treating a patient. Now, I'm a big AI proponent of empowering the nurses and doctors to do more with the limited time that they have and get them out of paperwork and all of the administrative burden, because no one got into healthcare to, stay up late at night, keying stuff into the EMR. But one doesn't replace the other. And I know the Trump administration is believing that bringing price transparency and bringing kind of this changes is going to somehow make health systems get more efficient. But there's going to be a lot of pain and suffering in that process. That's not going to be a fast process.
Let me ask you a question. I'm on this story here from Healthcare Dive. Molina plans additional ACA cuts in 2027. I mean, by next year, ACA is just going to be completely gutted.
Yeah.
I mean, it's going to be a shell of what it was, which is remarkable, right? To see how without direct attack legislature, through a bunch of proxy regulatory changes,
I mean,
the same effect was brought about.
My view is that in Trump version 1, they failed to kill ACA.
Right, in Congress.
And so they came in version 2 with a different strategy that is being very successful.
Very successful, right? So anyway, here's my question. My question is not about this specifically. My question is about the vibe that I've been feeling at these meetings, right? When we record these shows, every once in a while, I just sort of wonder, man, are we like overly negative? Talking about you and I.
Yeah.
Like, are we overly negative? Like especially like if we like end the show with a bad story, I'll be like, man, like, can't we do better than that? You know what I mean? And, we'll listen to Moonshots or All In or whatever. And Moonshots is probably a better example, right? Because those guys are, they are very, very intentional about being optimistic.
Yeah.
Like that is their.
That's the ethos of the show.
It's the ethos of the show. They're trying to be optimistic. And I enjoy the optimism, but I also listen and I feel that there is this avoidance or sweeping away when I listen to that show of what this transition is going to be like. It's like they just talk about this beautiful new frontier and all the things that are going to happen and all the greatness and all these things. And I'm like, I can have an imagination and a curiosity about how we could arrive there. And everything that I'm seeing on the way there is looking increasingly concerning, increasingly destabilizing, increasingly inequitable. I'm just wondering how, as innovators who got into this to make something better, how do we end up every week talking about all this stuff that's like so hard?
I think it's because I see too much optimism and like YOLO, let's just do this thing now on social media or media in general. And I have a lot of fear that doctors and nurses and hospital administrators and payers have kind of a belief that they're doing important work, and yeah, there's political fights, but it'll work out okay. It's always been fine. And I'm not sure I believe that. I mean, one of the things that I like about this show is we don't have sponsors. We don't have people telling us what we have to say, what we don't have to say. And so we end up just talking about what we're seeing in the news this week. And there's a lot of exciting things. I mean, there is, I'm not going to say it right, the Yogamoti factors. There's like rejuvenation technology, and people are using AlphaFold to invent new treatments for heart disease, which I really care about. And, making people look younger without doing a facelift, and all that's super exciting and is not going to help a poor person in LA when they need treatment. And so I think often we're trying to frame this for doctors and nurses and hospital administrators and people in the payer community that maybe don't have sources of news that they're seeing these things. And I don't think that the federal government is kind of organized to swoop in and save the day. I don't think that's what they're going to do. And maybe there'll be a new federal administration after 2028, but it's a long time from now.
The people that I've been engaging with over the last 60 days cannot somehow, quote unquote, leverage AI to get out of $100 million Medicaid loss next year. That's not, I mean, and look, could you?
No. You can't turn the ship that fast. Even if you hired the entire team of Anthropic, I don't think they can turn the people and upskill all the workers and deal with the physical infrastructure that's there in the time frame that would be needed to do that. I just don't think it's now. I mean, we're venture capitalists, so there's a lot of times, and I've been on boards that just where we say we have to make layoffs, we have to do a reduction in force, and maybe we could squeak by with a 30% reduction, but it is really damaging to the culture to do a layoff and then 6 months later another layoff, then 6 months later another layoff. Right. So it's better to let's do a 45% reduction.
Right.
And we'll take the really difficult cultural hit now. And then if we have to hire 40 people back 6 months from now, that's a positive sign, and that's better. And I think that's right. But doing it at a nationwide level with the health system that is, $5 trillion and something like 20 million clinicians is just a big experiment that we haven't done before. And I think a lot of people in the Trump administration come out of that sort of private equity, venture capital, innovator mindset, but they're working with a much bigger ship and with a group of people that are not used to this kind of change.
Yeah, and I guess I think about like the the cascading effects, right? So we're talking about people need to get a job, people need to get a job, people need to get a job, but we're very clearly going to implement a broad reduction in force, as you just said, across the number one hiring industry in the country. What percentage of those people won't be able to quickly find other work and will themselves end up being uninsured because they're not doing what they're supposed to do and working? You know what I mean? Like there's kind of like this really nasty domino effect of this. It's like a negative flywheel, you know, moving in one direction. And there's just been, I just feel like there's just been so many knocks against those who are not well positioned. Like if you're well positioned, there's so many ways you can insulate and isolate yourself to a point, not forever, but to a point. And make it so you don't have to feel the reality of what average everyday people are dealing with. But if it feels like it's stagnant or bad now, I mean, I just don't think people have priced in how fundamental an industry that represents 20% of GDP, that hires the most people, that like takes care of people when they're down, and never gets paid enough to do it. Right. Like what happens when you take the axe to that same industry again? You know, and I guess what I'm also saying at the same time is my exposure to the people leading that industry is at the highest levels, they understand this, but many leaders of institutions do not fully understand it.
And even if they understand it, they're not taking action today in July to be ready for next spring. They're
many. So some are.
Maybe some are, but not at the scale that will prevent a lot of difficulties. And
I mean, how can they? Like their options are pretty limited, right? I mean, they're just going to have to get ready for big. We're just going to see. We're going to have about 3 months where every week when we're doing the show, knock on wood, we're still doing the show. Yeah. We'll just be talking about this company had a riff, this company had a riff, this health system had a riff, this hospital shut down, this hospital shut down. It's going to be pretty implosive, you know?
Yeah. And that, I mean, the way I see it is that leads to a groundswell interested in democratic socialism. Because
which we already have.
Starting in pockets, I think. And I think it's going to grow dramatically because if they can't find a job and they can't get health care and the federal government's not taking care of them, I mean, healthcare is it's a weird industry because there's a lot of for-profit healthcare,
sure,
but there's also a lot of nonprofit, and then there's public health, and it's like this. There's a societal good aspect of it that we should take care of our people, and then there's also a for-profit, private equity-backed, venture-backed. There's people making money in it, and if that fractures, I think there's a lot of people that will say, I want to go with this candidate because he or she says they'll take care of me. And no one else is taking care of me. And the free market is not really working for my family. And I wish I wasn't negative, but I don't know that AI is going to be the primary source of job loss. I think it's a derivative source. I think it's going to be this is a reimbursement change. It's not really an AI change. And I don't think AI can step in and really solve it. And I think the truth is that, let's say we have 20 million clinicians, doctors, nurses, other types of clinicians. We need all 20 million. I mean, we need them in the healthcare system treating patients, But there's going to be this disruption where they need to leave LA and go somewhere else. That's going to be difficult.
Okay, so I want to keep moving on this democratic socialist line because I actually think like that the group that gets into that is going to get bigger and bigger and bigger.
Yeah.
I mean, so this was kind of, you know, the big VC story of the week, and it's not a healthcare VC story for us. You know, Travis Kalanick, who was the founder of Uber, has a robotics company. This robotics company is going to eat more jobs. Okay.
That's what it's designed to do.
I just have to say this. Like, I got so mad and sad at the same time when I was listening to All In maybe 3 weeks ago. And David Freeberg, who used to be the science guy, you know, and I guess now he is kind of, but he got all on this like California politics thing. And now he's kind of like Sachs, basically. I mean, he was like screaming on the pod about how, you know, there's not going to be this job loss. Where's the job loss? Where are the numbers? You know, for a science guy, it's like, well, can we have a conversation without you yelling, first of all?
Right.
But second, like, dude, there's a lot of job loss. Like, what are you talking about? Like, and you want to know why there's job loss? Because A16Z and a bunch of other guys just invested $1.7 billion into Travis Kalanick's new company called Atoms. Bain Capital is in, blah, blah, blah. You know, it's clearly a real world automation company.
Yeah.
Clearly. I mean, 1.7 billion. So it's like, let me explain what I mean when I say the spectrum of who's going to start thinking about democratic socialism. Yeah. So it's everybody from the worker who can look 2 years down the road and see how Uber has become Waymo, right? And say, well, obviously this is just the same thing coming for the food industry, right? To venture capitalists like us who are going to be like, dude, if one company is raising 1.7 billion, like that's a new bar for what the major leagues are. You know what I mean? Like, yeah, we're basically doing brick and mortar mom and pop corner stores
right
over here, writing $1 million and $2 million checks. 1.7 billion.
Yeah, and I think the jobs topic, I think, is really difficult because I agree. This company and others, Waymo is a good example. There's plenty. It's very clear to me that we will not need the same number of workers in the restaurant industry when Atoms is at scale delivering all of these very inexpensive and tasty food options that are great for consumers, just like Waymo is great for consumers. But where are those consumers going to get money to buy it? And yet we haven't seen statistically significant job loss yet. So like people will say, I want proof, and you are speculating. And the way I see it is both sides are right. Like it hasn't hit yet, but that doesn't mean it's not coming soon.
It's a bad faith argument.
Yeah.
It's a bad faith argument. We have enough priors to run the game theory.
And not even that.
Like the idea that I need the data today. And first of all, I think there is enough, first of all, it's a lagging indicator, right? Like the data you're asking for is lagging. It's not leading. Second of all, there is enough on the leading indicator side that is flashing red lights right now.
I don't even need to go there. In our business, we used to have at a peak maybe 18 people.
Yeah.
And we're doing more. I would argue we're doing more today.
No question.
With 3 people.
No question.
And we are maybe 6 months ahead of some firms, but we're not years ahead.
No.
And so I understand this because I'm living it. I can see it in my own company. I can see it in our portfolio companies. And I know what Travis is going to do. And it's because he talks about it. I mean, he's very clear. He is building, all of these, whatever, Kava. There's probably 30 companies that you walk through the line and you get you ask for your ingredients and the person makes it in front of you there, and then you take your bowl and you go home and eat it. There's probably 30 chains, and they each have several hundred stores. He is very clear that he's disrupting that space with a model that has 0 people. Totally. There's no people. He makes these bowls. He has 8 different styles. So you can get Asian, you can get American. You can go to the place and just get whatever you want. So like you want something different than I want. The robot puts it in like a little cubby, like we have downstairs. And then an Uber driver comes and picks it up.
Vic, when are we going to interact with humans?
I mean, it's going to be...
We're going to get in cars that are not driven by humans. We're going to get food delivered by a robot, made by a robot. We're going to talk to robots on our phone. We're going to get our health information from a robot. When are we supposed to connect with another human? When is that supposed to happen?
I know.
We're shrinking the size of our companies because we can.
Yeah. I mean, I think we need to create jobs so that people have a reason to get up in the morning.
How can we do it? How are you going to do it when a very, very, very talented, competent entrepreneur who I believe has a very high chance of being successful, enhanced by the fact that he just raised $1.7 billion to do it, is on the job to compete against the humans?
Yeah. I mean, I wrote an entire book to try to deal with this. And my answer was that it would be possible to have a community health kind of job where I'm taking care of 2 of my neighbors and I'm paid for that, because we need to find a way to get money to the population so that they spend money. Like, we have to eventually get to that point where, like, I don't think universal basic income will work because it's too depressing just to take money and not do anything.
Dude, not only is it too depressing, like, it doesn't. Okay. We'll have it if the Democratic Socialists get power. We will not have it if the Republicans have power. It is antithetical to their ethos. No, it's not going to happen. It would only happen if the pitchforks really came out and they had to do it to stay in power. But dude, the pitchforks actually have to come out. They can't theoretically come out. They actually have to come out. So the Republicans won't be doing this. Okay.
I mean, eventually you need
the DSA will do it, but DSA will do a lot more than that.
Yeah. Right.
It'll be a lot more than universal basic income.
Yeah. Well, that's the transition. We're going to have 2 parties that are very extreme. The Republicans are all about capital gains and owning a business in the top part of the K, just to shorten it. And the DSA is going to be about taking from the top part and supporting the lower part because that is fair. And they're going to fight it out. And I think it's going to be really bad for a couple of years. I feel like we went the wrong way. I was trying to go positive and I didn't.
No, I just think I'm just trying to be honest. You know, we started this to try to navigate policy, understand where investable opportunities are, and I think we've gotten that out of it.
Yeah,
you know, but I also think the more that we've studied, I consider this to be like study hall.
Yeah,
you know what I mean.
Yeah.
And I think the more that we've studied, the more that we've found a really troubling trend that, yes, the general public understands, but we have all these micro storylines that we've been tracking, you know, and they all just continue week after week to go in the wrong direction. I mean, I think that's part of it, right? Part of it is we're looking for the news. We pull these stories and it's like, what? Like this, like, you know, you just start putting it together and you're like, this is not looking good. You know, it's not looking good. And it's uninspiring, right? Like, at the end of the day, yes, we raise money. Yes, we have funds. Yes, we're backing entrepreneurs. Yes, but like the idea that the quality of the society in which you do all this in doesn't matter and should not affect you, like, that's just bullshit.
Yeah.
We're not robots, dude. You know what I mean? We're not robots.
Yeah. I mean, I agree. The only place that I see optimism is in biotech. Like, there's a lot of pretty interesting new treatments for really difficult diseases that are exciting.
That is a bright spot.
But that doesn't translate to jobs in any meaningful way.
No, it is a bright spot though.
Yeah, right. So
it is a bright spot.
We will see. I mean, we're going to see cures for things. We're already seeing some cures for things, and I just wanted to touch on that. But the rest of the storylines are really difficult. And I mean, war in the Middle East seems like it's escalating versus not escalating. And the political parties are not, I don't think they're going to get more willing to compromise. I think it's going the opposite way. I don't know. I mean, there's a lot that health systems and providers could do if they believed that their reimbursement was going to be cut by 30%, but they don't believe that. And so they're not taking action, and then there's going to be...
You don't think they believe that?
I don't know. I don't think they're taking action like they believe it.
So I think they do believe it, and I think the actions they are tuned to take are less potent than they have been historically. Because we're in like this Overton window, right? It's like it used to be. You just did a lot of lobbying, and you had a PAC, and and it used to be you appeal to your community, and you bought some ads or whatever, all of those things in this era, because over-the-top TV is not very powerful, because Andreessen Horowitz is writing checks too, because people are just kind of tired of the story. Generally speaking, like it's not a novel story, because
Trump himself is making billions from crypto.
Correct.
The crypto lobby is there are other forces that are contributing more.
There's other forces at play.
Yeah.
There are other forces at play. Yes. So I think that the playbook that they know how to use is waning.
Yes.
For sure. But it's the one they know how to use. So I think they're trying it. But they're trying it in a world where it used to be everybody was tuning into the same TV channels. And now, like, if you want to reach Blue America, you need to be talking on Blue Sky. If you want to reach Red America, you need to be talking on X. It's like it's a far more difficult challenge today than it was before. And then I think maybe we can also look to the fact that maybe a broad problem across the country is that we just have too many old people. It's not just a gerontocracy. It's just like we just have old people running everything, and these old people they're not up to speed on tech. They're not up to speed on these different social networks. They're not up to speed on crypto. They just think it's like weird and not real.
In politics, in health systems, in payers, in government, city government, and state government, everywhere.
And so they're not effective, right? Yeah. Because if you don't know how to use those things, A, you're not as effective as you could be. B, you don't even know who is effective. You know what I mean? Like I cannot tell you, Vic, what it feels like when I'm on stage and I talk about David Sachs and nobody knows who he is.
Yeah.
It just feels like this guy pulled off the masterstroke, It's like how many millions of people don't know who he is, and how much power has he amassed?
Yeah.
It's remarkable.
Yes. Same with Joe Rogan. I mean, there's a lot of people that haven't ever listened to
Joe Rogan, and
they know his name, but I don't know if people have listened to him.
Well, I'm literally saying brand ID. They know Joe Rogan. Yeah. They know Stephen Miller, right? Like,
they don't know even David Sachs's name.
They don't know his name.
And he likes it he wants it that way.
Yeah, dude. They don't know his name.
Yeah.
That's what I'm talking about. Like, if I were to ask my parents, and they have no business knowing who David Sachs is, right? They're 88. But if I were to ask my parents, who is he? they would have no idea.
I don't think my wife knows who he is.
Probably not.
I mean, if you don't study this stuff, maybe not every week, but every couple weeks, like on X, on YouTube, on podcasts, you wouldn't know. So there's different realities, and the people that are charged with making decisions, they're not up to speed.
Any other key stories we should talk about? You want to talk about this Google story?
Yeah, let's talk about Google. So Google came out with their earnings this week. The stock was down dramatically after the earnings announcement.
Didn't they have like a
profit
like up
profit
200?
was up 400% since last year. Their cloud business grew at 86% quarter over quarter. And they're investing in a range of $195 billion to $205 billion in Capex next year. The way I see that is that's because they see the demand for cloud services growing at 86%. They need more resources to serve that business.
How could you see that any other way?
Well, stock market didn't like it. And the reasoning I could find is 200 is an emotional number, and they were at 175, and 200 is scary. That does not make sense to me. But they are investing full speed in this, but the revenue is growing at the same pace.
I have a question for you.
Okay.
You brought me into this industry. I didn't really understand valuations before, you brought me in. I mean, now I've been working with valuations over a decade.
Yeah, right.
But you've been working with valuations a lot longer. So here's my question.
Okay.
Have you ever seen a market, and I'm combining public and private, where valuations were more difficult to wrap your head around? Was there ever a time was .com? How was .com compared to this?
.com was obviously wrong. This market is more nuanced than that, I think.
Yeah, that's right. It's not straightforward.
Right. So people were in a frenzy about .com and chasing, and it's just a tulip craze, right? They're super excited. The middle part of the bell curve jumps in all at the same time, and they prop up everything because they want access. We've seen that in crypto, not this year, but we've seen that in crypto happen. And it's just like part of the animal spirits of markets. This market, though, is I don't know, bipolar. There's like all these different cross currents. And in my mind, Google is a screaming buy. Like I have bought more in the last year. I think it has, they have the full stack. They have everything, and they have all the productivity apps.
The only thing they don't have is an impressive model release schedule.
And they don't have, their model is behind.
Yeah, we're saying the same thing. Yeah.
And I think that the value of models is getting commoditized, and that's not going to be as big a deal.
Doesn't Wall Street think that? I mean,
I don't know.
Because isn't that the reason why? I mean, SpaceX is down. I mean, Anthropic and OpenAI are both like holding, pumping the brakes. So I think the story is out, especially after last week. I feel like the story is out that this is going to be really hard to figure out how to maintain value in this model business.
Well, I think
without regulatory capture. I mean, it's pretty clear Anthropic is going for regulatory capture now, right? Very clear.
Yeah, I don't know if we're covering it. They're putting another $20 million in. So this is just a weird thing to get my head around. They're investing millions of dollars in state elections in order to increase regulation on themselves.
It's not it's regulatory capture. That's regulatory capture.
Yes, but they haven't won yet. I mean, okay, it's regulatory capture. But I don't. Once everyone sees it, it's harder to execute.
Yes. So there's a post on X. I'll send it to you, and
Okay.
we'll stick it in the show notes because it's like the guy from the White House Office of Science and Technology. So it's Trump advisor for the Office of Science and Technology, and he has this whole post about how we have proof that Moonshot AI, carried a widespread distillation attack on Anthropic, blah blah blah.
Yeah.
Like it's like one of those one of those essays,
Yeah.
And like every post after that was one of two flavors. It was either, yeah, they did it in like 15 days. Like that would be an all-time fastest distillation of all time. Okay. Or it was like, yeah, just like Anthropic distilled all of human information to include my book,
Right.
my videos.
Yeah.
You know what I mean? And so it's like there's no moral high ground for these companies. There's no moral high ground. There's no belief in it. And in a K-shaped economy, trying to fight to make the average American pay $50 for the same token that you could be paying cents for is like not a winning strategy.
Yeah.
So we're a long way off from the Claude that crushed it on the Super Bowl ads, right? It's a different story now.
Yeah. And Anthropic has a lot of smart people, but I think that it's a hard road. I mean, it's kind of like if your strategy gets out, it's much harder to execute the strategy. So,
okay, so can we get back to Google? Pulling up this ridiculously great quarter plus year over year standard of performance, and their stock price going down. I mean, so this is what I'm talking about. It's like this is the valuation stuff that I am just
does not make sense.
I am just struggling with. I'm with you. I mean, I am a Google shareholder, very happy. I believe long term they're so well positioned. It's like they've got so many great aspects of the network in place, so many. And if you just can kind of step back and look at it all together, they still own Waymo, right?
Yeah.
I mean, dude, look, I now that I'm in Nashville, more like
I've seen them all over the place,
dude. They're everywhere.
Yes.
In my 10-minute drive from the apartment to the office, I'll see like 10 Waymos now.
Yeah.
That was not the case 2 months ago.
No. And it's scaling from here. I mean, they're not slowing down. I mean, I think there is a small subset of people that think someone will get to like recursive self-improvement.
And then it's game over.
And it's game over, right. I don't believe that. I might be wrong, but I don't believe that. I think there's enough competition that there's going to be multiple.
There's enough proof points that's not true.
I mean, that's what I think. But
Kimi K3.
Yeah.
GLM 5.2. Like, I think those are the proof points. Like, it may not be the exact same thing, but it's right on the heels. It's going to be there. Like, I was talking to my son about this yesterday because, people don't know all the things. A lot of times, like, people are so US centric. My son, who I consider to be very, very smart about this stuff, and
he's an engineer.
Dude, he was the one who told me about NVIDIA like a million years ago.
Yeah.
Because he was a gamer.
Yeah.
He told me about NVIDIA forever ago, before there was AI. Okay, and I was talking about robots, and he didn't know about Unitree, and I was like, dude, you need to Google Unitree right now. And he looked at it. He was like, what?
I don't know if I know Unitree.
Dude, it's a Chinese robotics company that dances circles around Boston
and
Robotics Dynamics.
They did like the marathon.
Yeah,
over there,
dude, and all the kung fu. You do know.
Yeah,
I can show
I've
you
seen
10,
the videos.
I can show you 10 videos of Unitree robots that you'd be like, oh yeah, I know that. The dogs. Unitree's got the dogs.
Yeah.
It's like crazy robot company, right? And it's like, listen, the idea that a country with the power resources, the manufacturing power, They're the world's manufacturer.
Yeah.
Okay.
And the labor shortage.
It's like, you think they're not going to get to RSI too? Come on.
Yeah.
No, seriously, Vic. Like, you really think China's not going to get to recursive self-improvement?
I think China will. I think Google will. I think OpenAI. I think they're all going to be.
People going to get there. Yeah. It's not going to. There's nothing about that game that smells like it's winner take all. Nothing. It if anything, it smells like there's no moat.
Yeah, that's what I think. That's the. I mean, I think 80% there's no moat. 20% someone gets a. The thing about recursive self-proof is if you get a little lead, it can expand.
Sure.
But I think that's the 20% or less version.
Look, as you said so many times, you made the point to me last week. I had to actually like really add that to my ground truth, kind of thesis. Anthropic is compute starved.
Yeah.
Guess who's not compute starved? Google. Guess who's got their own chips and can optimize the AI to run on their chips,
yes.
The ones they invented.
Yes.
Why would you not bet on the organization that is not compute constrained? I don't like, it's those kinds of things. It's like you don't understand the full stack. So, okay, you're giving this company credit for this one thing. It's like, look at YouTube, look at Waymark, like look at the data asset that Google has versus the data asset that Anthropic has. I mean, bro, like these are not even in the same universe.
Right.
So like one is Little League and the other's the World Cup of data assets.
Yeah, that's right.
It's just not even remotely close. So yeah, so what? Google, Gemini, dude, what's to say Google is just? There's a very good chance Google is just like chilling in the cut and not showing their cards.
Yeah,
with the quality of model that they have. Because it would actually draw more attention to them. They'd have to deal with all this, national security nonsense.
Right. I mean, it's certainly true that they have multiple priorities. Right. They're trying to do a world model. They're doing AlphaFold. They're doing Waymo. They're doing 100 things, and optimizing their text-based model to be the best in mid 2026 is like the 30th thing on their list.
As it should be.
Yeah. Right.
As it should be.
I think it's just part of the crazy world. And then I think we should cover the OpenAI
health.
No, well, we can cover that, but the escape.
Oh, okay. Let's end here. Let's end here,
yeah.
and then we have some friends who have some messages. But OpenAI's model escaped and hacked a company in cybersecurity tests gone wrong. They were able to penetrate Hugging Face's defenses. For those who don't know what Hugging Face is, it is an online repository for all sorts of LLMs, all manner of them. You can find there. It's got benchmarks. It's got access. I think you can like use it as an API to run different models.
Yeah.
It's like all
a great
the things.
Service.
Yeah, it's all the things. It's all the things. And I think that they couldn't even stop the cyber attack with OpenAI because of all the guardrails, and I think they had to use like GLM 5.2 to stop the attack.
I don't know how they stopped it, but just to set the story, so OpenAI was trying to test the cyber capabilities of their new model, which is not released. I'm pretty confident it's GPT 6.0.
Yeah.
And they had it in a sandbox with no internet access. And the task was to assess benchmarks of a bunch of things, including this model. It decided that the fastest way to get the answer was to break out of the sandbox and hack Hugging Face, because that's where a lot of benchmark data is. And it just did it. And Hugging Face knew it was not a human hacker because of how fast it was moving. And OpenAI took as many precautions as they thought they needed. This was not that they didn't think the model was powerful. It's that I don't know if they couldn't stop it, but they didn't put enough guardrails in place. It is the first time that I know of that that's happened, where a frontier lab let a model get out of their control because it outsmarted them. So it just feels like it's a milestone on the road to.
So I asked Grok.
Okay.
about like how Hugging Face was able to stop it.
Yeah.
Because obviously, like what it did to break out was serious.
Yeah.
It was very serious. Hugging Face detected and contained the agentic swarm, tens of thousands of automated actions. For forensics on the attack logs, payload, commercial hosted U.S. frontier models, safety guardrails refused to process the material. Hugging Face therefore switched to a locally deployed MIT licensed open-weight instance of GLM 5.2, running it on their own infrastructure, let them finish the analysis without sensitive logs or credentials leaving their environment. So you can't use the U.S. models to do forensics on cybersecurity. You have to use the open-weight models.
They won't allow you to.
They won't allow you. They won't allow you.
Yeah.
They won't allow it to you.
Except when one of those frontier labs loses control of their model, you have to figure out some way to defend yourself.
So you are going to need a Chinese model to save yourself from a U.S. model.
Right. Yes. And Anthropic's trying to convince us to outlaw them. That's crazy.
It's crazy, dude. It's crazy. I mean, that is the epitome of trust me. Trust me,
right.
bro.
Yes.
It's like, how about no?
Right.
How about no?
Competition is healthy. And I'm sorry that Anthropic only has one product, but it's better for everyone who doesn't work at Anthropic or have a share in Anthropic to have open source models. Just is. Doesn't matter if they're from China or France or America or anywhere.
Sure doesn't. Sure doesn't.
I don't care where it came from. We're going to put it in our hosted site. It doesn't matter if Chinese people invented it or not.
You got to eat a piece of this cake that just got us. Health Further, episode 200. That's awesome. Very cool. I don't know if the camera can.
I'll send a picture.
Let's see if the camera can see this bad boy. There we go. It's right there with you, Vic. All right.
Nice.
Good. I got a little carver here.
Okay, nice.
Yep. You have to be messy. Eat it with your hands. But
I'm not going to let you feed me. It's too close.
I'm not going to let me feed you either, buddy. So don't worry about it. This has been fun, man. Thanks for showing
great.
up. You can't do this by yourself, right?
Yeah.
So
it's made me smarter.
Yeah, for sure. I tell people all the time when I'm on stage or whatever, I'm like, I couldn't do this talk without it.
You can't process this stuff without like another person to talk it back and forth, I think. And also, I mean, I'm lazy. Like, so if I didn't have to come and like be able to speak intelligently with you, I think I'd just skip it a lot of weeks.
Yeah.
And so it's helpful to have the.
Yeah. All right. Thanks for everybody who's been listening. Thanks to our producers. Thanks to just everybody for, continuing to encourage us to do this. It is a labor of love, but we are better for it for sure. And we hope it helps you process everything that's going on out there and somehow be better at navigating all things health innovation. And we'll turn it over to, we'll start with our buddy TK, who's been a regular guest on the show. And he's got a little message for everybody.
Marcus and Vic, Tarun Kapoor, TK here. Wanted to congratulate you on episode 200. It's been wonderful to see the evolution of the pod as it's evolved from very good to just absolutely fantastic. And it is part of my weekly staple. And thank you for letting me be part of that evolution. I wanted to give you my bold prediction for episode 300, which would be sometime in late 27. I believe, let's stick with the clinical AI angle. And I believe that clinical AI will go from being a nice to have to an actual requirement. And we will see our first deposition as to why a health system or a clinical practice did not use clinical AI to prevent a bad outcome. Keep crushing it. Look forward to seeing you soon.